This is Professor Michael Chapman. I'm one of the most experienced IVF doctors in Australia. I believe that an important part that I can contribute is to educate patients in relation to fertility, infertility, and all that involves. These series of podcasts help to educate you. I hope they are helpful to you. If you wish to know more, however, I'm more than happy to have you contact me via email, which is profmchapman@gmail.com, or make an appointment to see me on 9138 4222.
The question is from Jen, and she says, are other health issues such as kidney and gallstones a problem? Do they affect the success rates of IVF?
Obviously, any medical condition has to be taken into account when having treatment, any medical treatment, including IVF and including having a baby. So a good assessment is important. Gallstones rarely ever interfere. That's not an issue. Kidney disease depends on what the kidney disease is and how severe it is and how much it interferes, but even to the point of I've treated patients who are on dialysis and got successful pregnancies. So it certainly doesn't prevent it, but it requires a skilled care, a specialist who understands both the infertility issues but also the medical issues. We work closely with other specialties to get you through particular cycle and then the pregnancy afterwards.
Just before we lost you, you were saying something quite important about going to a trained IVF specialist and why Life Fertility is one of those. Could you talk a bit more about that?
Okay, so around Australia, there are probably, I think it's 1,800 gynecologists who've been through the basic training program that we have with the College of Obstetricians. Of those, there are probably 250 who are involved in infertility care. But of those 250, there's only about 90 of those who have been through the certified training program for infertility that our college runs and certifies these doctors. So it's an extra 3 years of training. It covers far more than what the basic O&G training covers. It covers male infertility in a lot more detail. It covers genetics in much more detail. And in terms of female problems, the hormonal side of it in particular, far more deeply understood by this group of 90. Now, the 90 can be recognised because on the end of their list of qualifications, their Bachelor of Medical Science and their membership of or fellowship of the Royal College of Obstetricians and Gynecologists, they will have another set of initials, CREI. And that stands for Certification in Reproductive Endocrinology and Infertility. And that says they've been through the 3-year training program and they have passed very rigorous exams before they go into it. So these are the peak leaders in terms of caring for patients with infertility. Now, of those 90, 4 of them happen to work in our clinic, Life Fertility Clinic in Sydney. 4 of us have passed the CREI and have CREI as our names. And so we are probably, percentage-wise anyway, the most qualified clinic in Australia. No one's got that percentage. 80% of our doctors have CREI. And in fact, the 5th doctor went through the training program, but because she went back to Ireland, she didn't ever sit the exams. And she's been doing fertility now for 15 years. So between us, in fact, that's the other part of life, is that between us, we have over 100 years experience between us treating infertility. So we're a highly experienced team, understand what you need, and give you the best levels of care.
And how do people get in touch? You offer telehealth consultations?
All of us are quite comfortable receiving referrals from all around Australia. In fact, I also have referrals or consultations with European patients who've seen me on my podcasts, but we do that either by Zoom or by telephone. We're based in Sydney, but are happy to at least do consultations and even do treatment almost remotely. We've had patients from outback Australia going to their local pathology services to do their blood tests, and then they only come to us on the final day before egg collection. And then they have to hang around for the transfer. We do cater for the whole of Australia at times.
And don't forget that you can access all the previous episodes by going to our website www.theivfjourney.com and select IVF Journey podcast from the navigation menu.